upper GI bleed? Upper GI means the source of the bleeding should be proximal to ligament of treats or proximal to DJ flexion. Simply put, the source should either be esophagus or stomach or duodenum. Okay, source of bleeding, esophagus, stomach or duodenum. Which is the most common source? Most common source, it is bleeding peptic ulcer. Okay, especially duodenal ulcer. Duodenal ulcers, especially D1, they are the ones which bleed, which are on the posterior wall. Anterior will perforate, posterior will bleed. Involved artery, gastroduodenum. Now, when the person gets upper GI bleed, what are you going to do? First, you will stabilize him. He will come with these symptoms, hematemesis, melena, I told you earlier. So first, you will stabilize him and take him for endoscopy. ABC, endoscopy. Now, what you see on endoscopy is given by the name forest grading. This I feel is important. They have never asked forest grading and it's very useful. So we should know it. Forest grading, 1A, the bleeding is coming like this, like a pichkari. That is arterial bleed. And 1B, it is a diffuse ooze. Both 1A and 1B, the bleeding is active. And obviously, if the bleeding is active, you will stop it. In 2A, 2B, 2C, the bleeding has stopped. It is a recent bleed. It's not bleeding right now. It must have happened some hours or maybe minutes ago. In 2A, there is a visible vessel. In 2B, there is a visible clot. And in 2C, there is a very small dot. Means it must have been a clot. Now it is just a dot. So 2A, 2B, 2C, recent. And 3, there is only an ulcer. There is no evidence of recent bleeding. It means it's an old bleed. Now, why do I need to know this grading, forest grading, apart from it being important for exam? It tells me risk of rebleed. It means if the person is 1A, 1B, risk of rebleed is very high. Okay, so 1A, 1B and 2A, high risk. 2B, medium risk. And 2C and 3, low risk. So it tells me risk of rebleed. Percentage, no, but at least the meaning you should know. Okay, at least the meaning you should know. High risk, medium risk, low risk. There are other severity scores also, Rockall score, Glasgow, Blatchford. Not that important. ये तो बहुत important है. And this is the endoscopic classification. So when I did the endoscopy, if it was active, means it is 1A, 1B. In this case, so I did endoscopy and the bleeding is active. Then obviously I have to do something to stop it. I can do one of these three things. Either I can put a clip or I can inject adrenaline in ulcer. It is local adrenaline. Or I can do argan plasma coagulation. Which of these should you do? Between these three, which one should you do? Should you clip? Should you coagulate? Or should you do adrenaline? You should do any 2 out of 3. Depending on the type of bleeding, any 2 out of 3 have to be done. This is called as dual endotherapy. Okay, this is called dual endotherapy. This is the treatment of choice for bleeding peptic ulcer. This is different from variceal bleed. Variceal bleed, you do only one thing. That is either band ligation or sclerotherapy. Here you have to do 2 out of these 3 things. Right? So 2A means you can see the vessel, na, which from where bleeding must have happened. Here you are only seeing a clot. That is 2B. So treatment of choice is going to be dual endotherapy. If he still bleeds despite dual endotherapy, you can try it once more. So endotherapy can be tried once more. But despite 2 endotherapies, if he continues to bleed, then you'll have to do some intervention. Either you will do angioembolization Either you embolize the bleeding or you may have to do surgery to stop the bleeding. Variceal bleed is not in the stomach, na? Variceal bleed is in the esophagus. I will show you the picture, then you will know. Right. So this is going to be the management of upper GI bleed. Again, I have given you a very standard, simple pathway, not too complicated. You will get the answer from this.